Hi everybody, welcome to Excellent Physio. Today we're going to be talking about the different types of surgery that we see through clinic and how physiotherapy can help you. So the most common types of surgery that we tend to see are the joint replacement surgeries. So this is where a joint is damaged and it's best to remove the old joint and have a new joint put in place by the surgery team. We also tend to see a lot of joint reconstruction surgeries. So this could be an ACL reconstruction or an Achilles tendon reconstruction. Quite often these then require a lengthy rehab process afterwards to return you back to the point where you're capable of doing what you need to do. So we also tend to see some of the smaller operations. These could be hernia operations or joint arthroscopies, and this is where there could be some damage or scar tissue within the joint and a surgical team will just go in and clean the joint out to remove some of your pain. More recently we've started seeing a lot more women's health surgeries coming through clinic. So this could be post C-section or it could be post hysterectomy. It's really important to see a physio after this because it's important to manage the scar tissue around the abdomen, but also working alongside a physio that can get you back to your best and get you moving correctly and coping with your daily activities in as little pain as possible. So how does physiotherapy help post-surgery? One of the things that we help do is we help reduce the pain and swelling that occurs immediately after surgery. This can often be quite uncomfortable and can limit your range of movement. We look at regaining your range of movement through a series of modalities that we do. And we look at regaining your strength in the muscles above and below the joint that's been operated and in the surrounding muscles around the area as well. It's important that you do this in a safe and controlled environment to ensure that the surgery works to its best effect and that you don't put any pressure through it and you don't run the risk of damaging the surgery in the first few weeks afterwards. So what stuff do we have in clinic that can help you post-surgery? So we are very lucky to have a Biodex isokinetic strength testing machine, which we can work on any joint in the body. So we can fix the joint up to the machine and we can strength test it compared to your non-operated side. This then creates a graph so we can see the difference between the two and we can then use that as a target for us to build your strength back up. Quite often we actually get you within a set percentage of the other side so that we know it's safe for you to return to sport or some of the activities that you're doing. It also allows us to set targets for you to work towards to try and build that strength and regain that range of movement. We have a series of strength machines within the gym. So we have a leg press, we have a seated leg extension, we have an overhead lateral pull down, we have a seated row. We also then have a weights bench with a series of weights that we can work you through. And under the control of a physio, it's in a safe environment and will push you slowly back to the level that you once were. In clinic, we also have a watt bike. So this is a really good piece of equipment for us to work on your cardiovascular fitness, but also working on the strength and power output of your legs. It's really good because on the machine we can calculate your power output, your average power output, and we can also calculate your cadence between left and right. So it gives us a lot of data that we can use to supply you with the information for you to progress forwards with your rehab. We have a complex machine, which is really good in the early stages of surgery. It's an electrical stimulation machine that we can put onto a muscle that helps stimulate the muscle and generate more power and strength and reactivate the muscle in the early stages post-surgery. Something like a knee replacement, this is really good, or post-ACL reconstruction, because in the early stages you quite often have a deficit in the quadriceps, so the surgery leaves you with a little bit of muscle inactivation. Using this machine in the early stages doesn't put any pressure through the joint, so the surgery is allowed to heal and no pressure is placed on it, but we can start to add some strength into the quadriceps from an early aspect. A lot of research shows that this helps improve your outcome further down the line. So your recovery becomes better, stronger and more efficient. We can then progress that through your rehab so we can have the machine working whilst you then progress on to weight-bearing strength exercises and more functional rehab as well, to help give us that extra influence to the quadricep muscles or other muscles that we're trying to use. Other treatments that we tend to use to help reduce pain, inflammation, and help regain your range of movement are things like acupuncture, ultrasound, and TENS machines. These are all things that our therapists are trained in, and they can help you and also discuss and advise you on using some of these modalities at home. So there you have it. There's a brief whistle-stop tour of how physiotherapy can help you post-surgery. Obviously, depending on the type of surgery, there's a lot more detail that we could go into, but if you have any questions, feel free to get in touch and see how we can help you.